be a gynae, one wants to be a surgeon and physician and all that. So government has been paying, and it continues to pay, but we are in arrears.
Okay.
So there was an issue where the university had said that it will not give exams to all those with arrears. In our Monday morning, and that is why I said it was a good meeting, from that discussion, the PS for Medical Services, Kimtai, is going to sit with the Vice Chancellor to reconcile the arrears.
Okay.
And we have committed, we have money now in the budget to pay all those arrears. So by the time the doctors are going to sit for their exams in September and October, there will be no arrears.
Okay.
But again, we really need to look at that program. Because one, this postgraduate, as a country, we need to focus. Where is it that we have minimal specialists? I can tell you from where I sit as the person in charge of decision-making and policy at the Ministry of Health, we have enough gynaes as a country.
In the country, okay.
So then we should now be working towards how do we build capacity in these other specialties that we do not have sufficient. For example, NCDs are on the rise. Cancer is on the rise. So as a country, then we need people now to specialize in oncologists. So then we are going to have some discussion there also to neaten that so that any postgraduate is towards filling the existing gap, the specialties that are there in terms of a gap.
Okay.
But those that we already have, for example, gynae,
Not
those
anymore.
then we will say, no.
Not anymore.
Let's fill the gap that we have.
One thing you told me, the deficit of the deficit that we have in the institutions.
Yes.
Could you explain the rationale? Probably, I know we are running out of time. Of the government integrating doctors from outside, the way they did with Cubans, yet we have a deficit. What was the rationale for that? And yet we have a deficit, and we have Kenyans on the waiting list.
For the record, that program, we ended it. I did end it while in office. We said, no, we cannot be having Cuban doctors while we have our own. The rationale by that time was one, and by the way, it was during a similar crisis of a strike. So the government's rationale was to fill the gap in the interim, but equally to have them come and work together with the Kenyan doctors so that then we are able to borrow from their system of primary healthcare. By the way, they specialize on primary healthcare in Cuba.
Yeah.
And those even specialists go to visit patients in their houses. That is what we expected. We even did an exchange program. Some doctors from Kenya went to Cuba, practiced, came back. They graduated, they came back. So now we have the same. We are going to integrate the same.
Okay.
And I hope then the doctors do not push government to looking for doctors from elsewhere.
Outside.
Yeah, now that we have sufficient resources.
Because that's what exactly they're doing, bringing other people. You can bring other people because they're pushing it to the wall. As we end the show,
yes,
I don't hold brief for Dr. Amoth. I don't hold, but it's a concern. 5 years acting, it's been advertised again.
Yes.
What are some of the qualifications, and what has disqualified him in 5 years to the extent that after acting for 5 years, you need another one? You need a substantive medical director. What's going on?
One, clarity, to clarify. The advert does not exclude him.
He can apply.
He can apply.
Yeah.
He is not excluded from the application. The issue around that position has been what was put in the Health Act. You know, there's this danger of you put in place a law ring-fencing it for certain cadres of certain people.
Okay.
So anytime public service advertise for that position, because the Act now says that it has to be a medical officer. Other cadres, the nurses are saying, no, we can also make good director generals.
Yeah.
The clinical officers, the public health, the nutritionists, other cadres are saying now they can make good director generals as well. So if you look at the advert that went out latest, I think 2 days ago, is that now that space has been opened up and expanded, that if you have a course in medical-related field, that has now been expanded. Based on that expansion, then these other cadres can apply. So now Amoth is applying as well. And I have confidence, given the experience that he has, he should emerge as the best, unless he fumbles during the interview. But I have confidence that he has adequate experience. He should be ahead of the pack.
After 5 years, why don't you just absorb?
I wish it was that easy.
Yeah.
My hands are tied by the law. If it was, in fact, I wanted to confirm him the day I landed in the office.
Really?
If you listen to my speech when I was taking up from Mutahi Kagwe, 3/4 of the people who sat on the table as directors were in acting capacity. And even now, they are in acting capacity. We have Kenyans who feel that they have a right to everything. When we did our structure, now to ensure that we fill these positions permanently, somebody went to court. They were awarded by the courts.
Okay.
So now at least we have managed to finalize on the structures. We have sent our indents to Public Service Commission. And as a result, that is when you saw the adverts now coming out, so that we can now substantively fill the positions.
Okay, I'm glad that you, at least the ministry, obeyed the court on that. Minimum. I'm told
we do obey.
Especially on the CBA. Minimum here is if you implement the internship program according to the CBA, these doctors are able and are willing to go back to the hospital as soon as tomorrow. That's the imperative according to them.
I have said, Ken.
Would it work? Let me just ask, would it work? If they gave you that as the minimum, why don't you then just go with implementing the CBA and absorbing these interns the way this program should run, and we are going back to the hospital tomorrow? Is that workable? Because there are a lot of issues.
Let me tell you, I can even say they come tomorrow if it is under that CBA. But they will work for the year and there will be no money to pay them.
Okay, okay. That's the
challenge. They will not get anything.
That's the challenge.
Yes, that
and
is
they'll still be on your neck.
They'll still come back to me. So how about we just resolve this issue once and for all? And I'm inviting them to the table. Okay. Please come. Let us resolve this issue for once and for all.
Are you committed
very
to negotiate with them?
Very committed and convicted that we are on the right journey to resolve this issue.
Holding joint responsibility, I don't know what it's called in within the cabinet, but the joint
collective responsibility. Yes.
Your colleague in Labour, when they were going to negotiate, 18 out of 20 were lawyers. Only 2 were from the ministry. Is that goodwill?
Lawyers from?
Sent by the Ministry of Labour.
No, you know, the conciliatory meeting that was called, and I'm in copy of the letter, there are 3 people who were appointed as conciliators. Those are the people that were to drive the process. As a ministry, we send our state council, we send our secretary for administration, we send our deputy director general, we send our director for human resource, and we send our, who else did we send? The DG. Yes. So the ministry is at liberty to send people who can resolve the issue. Because again, you see, you cannot have certain people sitting there, yet you cannot make decisions. You may end up with a decision that you can't implement. So you first have the technical people sitting, so that whatever it is that they decide, then it gets upwards to a level that then it is, when a decision is taken at this level, it is implementable. Okay. Otherwise, you can go there as cabinet secretaries, we say, okay, from tomorrow we do 1, 2, 3. Then you come down and realize the technical officers tell you, oh.
So those are technical officers. So you still think it was goodwill? Because that's one of the things they said at the press conference today, that they don't see goodwill.
It was goodwill. On the first day of the conciliator meetings, the union does not appear. They send their lawyer.
Okay.
Yeah, so I think these are technical matters that need to be discussed and understood, then they can be brought to a level of decision making. Like that CBA, if I read it with a lay woman's mind, there are things that I might misinterpret. But when you have a state council, you have a technical officer, they interpret those issues. So that by the time they are bringing to my table to make a decision, it's an informed decision.
Okay.
Yeah.
Too much to talk about, too little time. Can you imagine 1 hour is gone? But I want to thank you, CS, for coming and sharing this with Kenyans. At least now they know where it bites, and let's see what happens in the coming days, because tomorrow we are hosting, my colleague Ashley will be hosting the officials from Kenya KMPDU, and we'll likely hear the side of the story and collaborate some of the things that the CS is saying today. But I want to thank you very much and being candid and honoring us with your answers tonight. Thank you so much for coming.
Thank you, Ken. We are available even on this table with the unions, because I believe when 2 people reason together, they'll find a solution. Okay. So we are available to discuss, so that it should not be us versus them. This problem is for all of us to find a solution. So based on the guidelines, I want to make an announcement to all the interns. We are starting posting tomorrow. Okay. Please come and start picking your letters.
The concern is
after
underward
that,
CBA.
you will get your license and you can get employment, whether in government